Hey everybody, how's it going? Hope everyone's having a great weekend. This is Ramin Azarm, LCSW at Flex to Success Clinical Rehabilitation Services, and today I'm going to do a video on somatic symptom disorder. This one is really interesting. It's also known as hypochondriasis, but the DSM-5 did away with that term. They no longer use that term anymore. It's now called somatic symptom disorder, or SSD. So without further ado, let's jump right into it and get into some clinical discussion about SSD. So SSD is defined as a cluster of individuals that hyperfocus on physical symptoms such as pain, muscle weakness, shortness of breath, lethargy, dizziness, and or cold symptoms that cause major distress, distress, and or problems with daily functions. Common symptoms are excessive thoughts, feelings, behaviors related to perceived physical symptoms. The symptoms may or may not be associated with a medical condition and are almost always exaggerated. Individuals with this illness are convinced that they are sick or ill. In some cases, the symptoms might be non-existent. So the criteria for SSD: you must have one or more symptoms that are causing impairments in your daily functioning, such as eating, showering, or completing social and occupational functions, such as communicating with friends or working at a job. So if you're self-isolating a lot and excessively thinking about your symptoms and really hyper-focused on them and unable to engage in social functions, and you're canceling a lot on people just to kind of stay home and waste your time, indulging in these perceived catastrophic symptoms that you think you might have, that would be a surefire sign that you have a serious problem with SSD and that you should possibly get checked out so that maybe you can engage in some talk therapy that could be helpful, or even some medication management that might help to reduce those excessive thoughts, excessively intrusive thoughts. The second criteria is excessive thoughts or behaviors related to the physical symptoms. So one example of behaviors that could be part of this particular illness would be like going online excessively, like looking up symptoms and thinking that you have cancer or HIV, or it could be anything. You're having a heart attack, you have muscular dystrophy, whatever it is that you're hyper fixated on or focused on, and you're spending a massive amount of time looking up these symptoms, and it's causing impairments in your functioning, like was mentioned before. That would mean that, you might want to get checked out. You might want to find out what's going on here. Why am I spending so much time, focused on this? Now, I know that some people do this like periodically, like maybe like once a year or twice a year. You get a weird symptom that you've never seen before, and it freaks you out a little bit, and you might go online and start fact checking, or looking up different symptoms of different illnesses. If it's happening like once or twice a year, that's not what we're talking about here. We're not talking about the people who just kind of periodically do this every once in a blue. We're talking about people that do this on a daily basis, on a weekly basis, on a much more consistent basis than somebody that just kind of intermittently, periodically, out of the blue, just happens to get a little freaked out by a symptom and look it up online. So don't confuse and think, oh, because I did this one time 5 years ago, I have SSD. That's not how it works. It's got to be a persistently pervasive and consistent range of symptoms where this is something that's really interfering with your ability to function in everyday life. If you can't groom yourself, if you can't go to work, if you can't set up appointments with friends because you're hyper fixated on this, that's an issue. Another criteria is a significant amount of time and energy must be spent on, fact checking or thinking about the symptoms excessively. It doesn't give a time frame, but it says excessive. Excessive would mean like every day, every couple of minutes, every hour, every week. It would have to be some consistent form. Even every month, if it's every single month, that's considered excessive. So it also another criteria would be high anxiety when you're thinking about the symptoms. So if you're thinking about this and it's giving you significant anxiety, you're getting chest palpitations, your palms are becoming really sweaty, you're snapping at people and getting really angry because you're kind of fixated and stuck in the thoughts that something really bad might be happening. If it's taking up hours of your life, please go get checked out. Let a therapist or a psychiatrist do an evaluation on you and get to the root cause of what might be causing this, and give you some options of how you can receive treatment that can improve your quality of life. So those are the criteria. A couple other things to note with this particular illness. A lot of times people that are diagnosed with SSD, they'll go to the primary care physician way more than they need to. So they'll be constantly setting up appointments for perceived symptoms that they might have. Oh, I have back pain. Oh, I feel dizzy. Oh, I have this. Oh, I have that. Meanwhile, it's very minor and slight and not really necessary for them to be making these appointments. A lot of times the doctor will kind of pick up on it when the person's like constantly coming in with like a new thing, but then every time they come in, they're fine. The doctor will eventually kind of pick up on it and probably make a recommendation. Why don't you talk to the social worker? Why don't you talk to, let me give you a referral for a psychologist, for a clinical social worker, for maybe even a psychiatrist, depending on the level of symptoms and how pervasive and excessive it is. And that could be based on client report, that could be based on what the doctor's observing, or a combination of both. It could even be like family members who are saying, listen, this is what he's doing. It's excessive. It's every day. He's a little embarrassed to tell you about it, but since he signed a release of information, I can talk to you, and this is what's going on. The doctor could even make a recommendation for, a clinical referral based on that. So another thing to note is usually one symptom is actually present constantly with people that have SSD. So they might have dizziness every day. They might have, let's say they have COPD, they might have a cough like every single day. But what makes it a problem is that the person builds it up in their mind to be like this big scary symptom that's going to cause them like a ton of problems, or could be leading to this other big giant illness that they don't have. And that's where it gets a little sketchy and complicated, because now the person's making decisions as if they have this cancer or HIV or hepatitis C, or they're making decisions assuming that they already have these conditions when they really don't. They're seeking emergency care at the hospital, and that was the other thing I wanted to say. A lot of times people will look out for, they'll take themselves to the hospital excessively, and they'll go to the emergency room, and they'll sit in the emergency room for hours upon hours upon hours, day after day after day after day, because they're so terrified and anxious that they might have some really, severe debilitating illness. And in all actuality, day after day after day, the tests are ran and the doctors tell them, you are fine, you don't have anything wrong with you, you can go home, you are safe. And they get that reassurance, they go home, and then the behavior just repeats itself over and over and over again, because the person just has this undying urge that something bad is happening to them internally with their health, and they want to be a proactive person and address it, when in fact it's somewhat of a delusion. So that's my presentation on somatic symptom disorder. Cognitive behavioral therapy works really well with it if you want to engage in some type of therapy that could possibly help. Maybe like look at some of the rituals that you're doing, replace those ritualistic behaviors or excessive thoughts and feelings with more positive actions. You can also look into medications that could possibly reduce the excessive intrusive thoughts. SSRIs are very helpful. Mood stabilizers are very helpful. Different examples of those would be like Prozac or Luvox, or you could even use, it would mostly be like Zoloft or antidepressants that would be more beneficial for someone who's experiencing intrusive, excessive thoughts like that. So that's my presentation. I hope everybody enjoyed it. If you have any questions, please leave it in the comments below. I am trying to blow up the channel, so please share with your friends, get everybody involved in these videos, have them post their opinions. Let's start a clinical discussion about some of these illnesses that I've been going over in the videos that I've already uploaded. And I hope everybody has a great weekend and a great day. The weather's really nice today, so get out and do some walking and enjoy it. All right, take care, everybody. Have a great day. Bye.